Right now, as you watch this video, there could be invisible poisons silently destroying your nerves. That tingling in your hands, that numbness in your feet, that burning sensation that keeps you up at night. These are not random symptoms. They are warning signs that something toxic is attacking your nervous system. And the scariest part is that most people have no idea where these toxins are coming from. Here is a number that will shock you. According to the National Institute of Neurological Disorders and Stroke, over 20 million Americans suffer from peripheral neuropathy. That is nerve damage that causes pain, numbness, and weakness, usually starting in your hands and feet. But here is what most doctors do not tell you. A significant percentage of these cases are caused by toxic exposures that could have been prevented. Research published in the Journal of the Peripheral Nervous System found that toxic neuropathy accounts for up to 15% of all neuropathy cases. 15%. That means millions of people are suffering from nerve damage caused by poisons they encounter in their daily lives. Your nervous system is incredibly delicate. Your peripheral nerves are like electrical wires that carry signals between your brain and the rest of your body. When toxins enter your system, they can strip away the protective coating around these nerves, called the myelin sheath. Think of it like the plastic insulation around electrical wires. When that coating gets damaged, the signals get disrupted. The result is pain, numbness, tingling, and eventually permanent nerve death. What makes this even more alarming is that many of these toxins are hiding in plain sight. They are in your food. They are in your water. They are in products you use every single day. A study from the Environmental Health Perspectives Journal found that nearly everyone tested had detectable levels of at least one neurotoxic chemical in their blood. We are all being exposed whether we realize it or not, but knowledge is power. Once you understand which toxins are attacking your nerves, you can take steps to protect yourself. You can reduce your exposure. You can support your body's natural detoxification systems. You can potentially stop nerve damage before it becomes permanent. Now here is what really got my attention when researching this video. The number one toxin on our list is something that over half of American adults consume regularly. A landmark study published in the journal Neurology followed participants for over a decade and found that this single toxin was responsible for more cases of toxic neuropathy than all other causes combined. It damages nerves in a way that is often irreversible, and the symptoms can appear years after the damage has already been done. Make sure you stay until the end, because understanding this toxin could literally save your ability to walk. Before we begin, let us know in the comments now your age and where you're watching us from. We read and reply to every single comment, so drop your comments below. Number 8. Thallium. Let us start with one of the most sinister nerve toxins ever discovered. Thallium is a heavy metal that has earned the nickname the poisoner's poison because it is colorless, odorless, and tasteless. It was actually used as a murder weapon throughout history because victims had no idea they were being poisoned until it was too late. Thallium attacks your nerves through a devious mechanism. It mimics potassium, which is an essential mineral your nerve cells need to function. Your body cannot tell the difference between thallium and potassium, so it absorbs the poison readily. Once inside your cells, thallium disrupts the energy production machinery and causes oxidative stress that destroys nerve tissue. Research published in the Journal of Medical Toxicology found that thallium is approximately 1,000 times more potent as a neurotoxin than lead. The symptoms of thallium poisoning typically begin with severe pain in the legs and feet. This progresses to numbness and tingling that spreads upward. A characteristic sign is hair loss, which usually occurs about 2 to 3 weeks after exposure. Studies from the Centers for Disease Control show that even low-level chronic exposure can cause progressive neuropathy that develops over months or years. Where does thallium exposure come from today? The primary sources include contaminated groundwater near industrial sites, certain herbal supplements from unregulated sources, and some older rodent poisons that may still be found in homes. A study published in Environmental Research found detectable thallium levels in up to 12% of groundwater samples tested near former industrial areas. To protect yourself from thallium exposure, you should have your well water tested if you live near any current or former industrial sites. Be extremely cautious about herbal supplements, especially those imported from countries with less stringent regulations. If you have old rodent poisons in your home, dispose of them properly through your local hazardous waste program. Supporting your body's natural detoxification through adequate hydration and consuming sulfur-rich foods like garlic and onions can help your body eliminate any thallium exposure more efficiently. Now let us move on to a toxin that workers in certain industries face every day. Number 7. hexane and industrial solvents. If you have ever worked in manufacturing, printing, or even certain food processing facilities, you may have been exposed to one of the most dangerous categories of nerve toxins. Hexane and related industrial solvents are everywhere in modern industry, and they have a particularly nasty effect on peripheral nerves. Hexane is a hydrocarbon solvent used in everything from glue manufacturing to vegetable oil extraction. What makes it so dangerous is its ability to be absorbed through both inhalation and skin contact. Once in your body, hexane gets converted into a metabolite called 25-hexanedione. These chemical attacks the structural proteins inside your nerve fibers, causing them to swell and eventually die. Research published in the journal Neurotoxicology found that workers exposed to hexane developed neuropathy at rates up to 40 times higher than unexposed populations. The neuropathy caused by hexane follows a distinctive pattern. It typically starts with numbness and tingling in both the hands and feet simultaneously. This is followed by progressive weakness that can become severe enough to cause difficulty walking and gripping objects. A landmark study of Chinese workers in the 1990s documented over 500 cases of hexane-induced neuropathy in shoe manufacturing facilities. Many of these workers became permanently disabled. The scary part is that hexane exposure is not limited to industrial workers. This solvent is used in the extraction of many vegetable oils, including soybean oil and canola oil. While the final product should contain minimal residue, research published in Food Chemistry found that some oils retained trace amounts of hexane. Additionally, many household products like rubber cement, certain adhesives, and some spot removers contain hexane or related solvents. To minimize your risk, choose expeller-pressed or cold-pressed oils which do not use hexane in their extraction process. If you work with solvents, always use appropriate ventilation and protective equipment. Read labels on household products and avoid prolonged exposure to adhesives and cleaners in enclosed spaces. If you develop symptoms of numbness or tingling and have occupational solvent exposure, report this to your doctor immediately, as early intervention can prevent permanent damage. The next toxin on our list has been poisoning humans for thousands of years. Number 6. Arsenic. Arsenic is one of the oldest known poisons, and it remains one of the most significant causes of toxic neuropathy worldwide. Unlike some toxins on this list, arsenic exposure is often completely invisible. You cannot taste it, smell it, or see it in contaminated water or food. Arsenic damages nerves through multiple mechanisms. It interferes with cellular energy production by disrupting enzymes that your nerve cells need to survive. It also generates massive amounts of oxidative stress that destroys the delicate structures inside nerve fibers. Research published in Environmental Health Perspectives found that chronic arsenic exposure at levels as low as 10 parts per billion in drinking water can cause measurable nerve damage over time. The neuropathy caused by arsenic typically develops gradually with chronic exposure. Symptoms include burning sensations in the feet that often spread to the hands. This is frequently accompanied by skin changes, including darkening and thickening, particularly on the palms and soles. A study published in Neurology examined over 3,000 people in Bangladesh, where arsenic-contaminated groundwater is common. They found that 23% of those with high arsenic exposure had clinical signs of peripheral neuropathy. Where is arsenic hiding? The most common source is contaminated groundwater, particularly in areas with certain geological formations. The United States Geological Survey estimates that over 43 million Americans get their drinking water from private wells that may contain arsenic above safe levels. Additionally, arsenic is found in rice, which absorbs it from soil and water more efficiently than other grains. Research from Consumer Reports found that some rice products contained concerning levels of arsenic, particularly those grown in certain regions. Protecting yourself from arsenic starts with knowing your water source. If you use well water, have it tested for arsenic specifically. Standard water tests do not always include this metal. If arsenic is detected, install a reverse osmosis filtration system which removes up to 95% of arsenic. For rice, vary the types and sources you consume and rinse rice thoroughly before cooking. Cooking rice in excess water and draining it like pasta can reduce arsenic content by up to 60%, according to research published in PLOS 1. Speaking of metals in our environment, let us discuss one that has received a lot of attention recently. Number 5. Mercury. Mercury is a potent neurotoxin that accumulates in the body over time. Unlike some toxins that your body can eliminate quickly, mercury binds tightly to tissues and can take months or even years to clear. This means that repeated small exposures add up to create serious problems. Mercury damages nerves by binding to selenium, which is a mineral that your nerve cells need for antioxidant defense. Without adequate selenium protection, your nerves become vulnerable to oxidative damage. Mercury also disrupts the blood-brain barrier and interferes with neurotransmitter function. Research published in the Journal of Trace Elements in Medicine and Biology found that mercury levels correlated directly with the severity of neuropathy symptoms in exposed individuals. The peripheral neuropathy caused by mercury typically presents as numbness and tingling in the extremities, along with tremors and coordination problems. A study published in Environmental Health followed dental professionals who had occupational mercury exposure. They found that even at levels considered safe by regulatory standards, there was a measurable increase in neurological symptoms, including peripheral neuropathy indicators. Mercury exposure comes from several sources. The most significant for most people is consumption of large predatory fish like shark, swordfish, king mackerel, and tilefish. These fish accumulate mercury from smaller fish they consume throughout their lives. The Environmental Protection Agency estimates that fish consumption accounts for the majority of mercury exposure in the general population. Other sources include certain traditional medicines, dental amalgam fillings, and some skin lightening creams that illegally contain mercury compounds. To reduce mercury exposure, limit consumption of high mercury fish to no more than 1 serving per week. Choose lower mercury options like salmon, sardines, and tilapia instead. If you have numerous old dental amalgam fillings, discuss the risks and benefits of replacement with a dentist who uses proper mercury-safe removal protocols. Always avoid skin products that claim to lighten skin, as these sometimes contain illegal mercury compounds. Supporting your body's mercury elimination through consuming adequate selenium found in Brazil nuts and ensuring good liver and kidney function can help clear mercury more efficiently. Now let us talk about a toxin that most people encounter without even knowing it. Number 4. Organophosphate pesticides. Every time you eat conventionally grown produce, you may be exposing yourself to one of the most dangerous classes of nerve toxins ever created. Organophosphate pesticides were originally developed as nerve agents for chemical warfare. Today they are sprayed on crops around the world and residues end up in our food supply. Organophosphates attack your nervous system by inhibiting an enzyme called acetylcholinesterase. This enzyme is responsible for breaking down acetylcholine, which is the neurotransmitter that controls muscle movement and many other nerve functions. When this enzyme is blocked, acetylcholine builds up and causes your nerves to fire continuously. This overstimulation eventually leads to nerve damage and death. Research published in the Annals of Neurology found that farm workers with chronic organophosphate exposure had significantly higher rates of peripheral neuropathy compared to unexposed populations. The neuropathy caused by organophosphates can be particularly severe. A condition called organophosphate-induced delayed neuropathy can develop 1 to 3 weeks after exposure. This causes weakness that starts in the legs and can progress to complete paralysis in severe cases. A study published in the journal Neurotoxicology documented that even low-level chronic exposure through diet was associated with subtle but measurable changes in nerve function. The scary reality is that organophosphate residues are commonly found on conventional produce. The Environmental Working Group tests produce annually and consistently find detectable pesticide residues on the majority of samples. Their research shows that some popular fruits and vegetables, like strawberries, spinach, and apples, frequently contain multiple pesticide residues. While individual exposures may be small, they add up over a lifetime of eating. Protecting yourself starts with choosing organic produce whenever possible, especially for the most contaminated items. If organic is not available or affordable, thoroughly wash all produce and consider peeling fruits and vegetables that are known to have high residue levels. Diversifying your diet reduces exposure to any single pesticide. Supporting your body's detoxification through consuming cruciferous vegetables like broccoli and cabbage can enhance your ability to process and eliminate pesticide residues. If you work in agriculture or live near farms, consider having your acetylcholinesterase levels tested as a marker of exposure. The next toxin has been poisoning humanity since the Roman Empire. Number 3. Lead. Lead is perhaps the most well-studied neurotoxin in history, and despite decades of efforts to reduce exposure, it remains a significant threat to nerve health. Lead does not belong in the human body at any level. There is no safe threshold below which lead exposure causes zero harm. Lead damages nerves through multiple pathways. It interferes with calcium signaling, which is essential for nerve function. It generates oxidative stress that destroys nerve cell membranes. It also disrupts the production of myelin, the protective coating around nerve fibers. Research published in Environmental Health Perspectives found that blood lead levels as low as 5 micrograms per deciliter were associated with increased risk of peripheral neuropathy. For reference, the average American adult has blood lead levels around 1 microgram per deciliter, but many have higher levels, especially those with certain exposures. Lead-induced neuropathy typically affects motor nerves more than sensory nerves. This means weakness often appears before numbness. The classic presentation involves wrist drop, where the muscles that lift the hand become weak. A study published in the journal Occupational and Environmental Medicine followed battery factory workers and found that peripheral neuropathy prevalence increased in direct proportion to cumulative lead exposure over their working lives. Where is lead hiding today? Despite the removal of lead from gasoline and paint decades ago, exposures continue. Older homes built before 1978 may contain lead paint that creates toxic dust when disturbed. Lead pipes and plumbing fixtures can leach lead into drinking water, especially if the water is acidic or sits in pipes for long periods. Some imported spices, ceramics, and traditional medicines have been found to contain dangerous lead levels. A study from the Food and Drug Administration found that certain imported spices had lead levels hundreds of times above safe limits. Protecting yourself requires vigilance. If you live in an older home, have it tested for lead paint and consider professional remediation if found. Test your water for lead, especially if you have older plumbing. Run the tap for 30 seconds to 2 minutes before using water for drinking or cooking if it has been sitting in pipes. Avoid imported spices and ceramics from unregulated sources. Ensure adequate calcium and iron intake, as these minerals compete with lead for absorption and can reduce how much lead your body takes up from exposures. Now let us discuss a toxin hiding in your kitchen. Number 2. Acrylamide. This toxin is created every time you fry, bake, or roast certain foods at high temperatures. Acrylamide forms naturally when starches are heated above about 248 degrees Fahrenheit. It is in your French fries, your toast, your coffee, and countless other foods you probably eat every day. And research shows it is damaging nerves at a scale we are only beginning to understand. Acrylamide is converted in your body to a compound called glycinamide, which attacks nerve proteins directly. It binds to the structural filaments inside nerve fibers and causes them to accumulate and malfunction. This leads to a condition called distal axonopathy, where the longest nerve fibers die first. That is why acrylamide-induced neuropathy typically starts in the feet and hands and progresses toward the body. Research published in Neurotoxicology found that workers in industries that produce acrylamide developed peripheral neuropathy at rates significantly higher than the general population. What makes acrylamide especially concerning is how widespread dietary exposure has become. The Food and Drug Administration has tested thousands of food products and found acrylamide in the vast majority of fried and baked foods. French fries can contain over 1,000 parts per billion. Potato chips often exceed 2,000 parts per billion. Coffee contains moderate levels that add up with daily consumption. A study published in Food and Chemical Toxicology estimated that the average American consumes enough acrylamide daily to cause measurable biological effects. Research on dietary acrylamide and neuropathy in humans is still emerging, but the evidence is concerning. A study published in the journal Neurotoxicology and Teratology found that higher dietary acrylamide intake was associated with poorer performance on tests of nerve function. Animal studies consistently show that acrylamide causes peripheral neuropathy at doses not far above typical human dietary exposures. Reducing your acrylamide exposure requires changing how you prepare and choose foods. Avoid overcooking starches. Toast bread to a light golden color rather than dark brown. Cook French fries to a golden yellow rather than deep brown. Choose boiling or steaming over frying or roasting when possible, as these methods do not generate significant acrylamide. Soaking potatoes in water before cooking reduces acrylamide formation by up to 40%. Be aware that processed snack foods often contain the highest levels, so limiting these can significantly reduce your exposure. Finally, let us talk about the number 1 toxic cause of neuropathy. Number 1. Alcohol. If you drink alcohol regularly, this may be the most important health information you ever receive. Alcohol is the single most common toxic cause of peripheral neuropathy in the developed world. It damages nerves directly and indirectly through multiple mechanisms that can lead to permanent disability. Alcohol is directly toxic to nerve cells. It disrupts the membranes that surround nerve fibers and interferes with the transport of essential nutrients within nerve cells. But the damage does not stop there. Alcohol also depletes your body of thiamine, which is vitamin B1. Your nerves absolutely require thiamine to function and produce energy. Without adequate thiamine, nerve cells literally starve to death. Research published in the journal Muscle and Nerve found that up to 66% of chronic heavy drinkers have evidence of peripheral neuropathy on examination. The neuropathy caused by alcohol typically begins with burning pain and tingling in the feet. This progresses to numbness and weakness that can eventually affect walking. In severe cases, patients lose the ability to feel their feet entirely, which leads to injuries and infections they cannot detect. A landmark study published in Neurology followed over 4,000 participants for 11 years. They found that those who consumed more than 3 drinks per day had a 40% increased risk of developing peripheral neuropathy compared to non-drinkers. What makes alcohol-induced neuropathy particularly tragic is that it often becomes irreversible if not caught early. Research published in the journal Alcoholism Clinical and Experimental Research found that nerve damage from alcohol continues to worsen for months after drinking stops in many cases. The window for recovery closes as nerve cells die rather than just become dysfunctional. The only way to protect yourself is to limit alcohol consumption or eliminate it entirely. Current research suggests that any amount of alcohol carries some risk, but heavy consumption is by far the most dangerous. If you drink, ensure you are getting adequate thiamine through diet or supplementation. Foods rich in thiamine include pork, legumes, and fortified grains. If you have any symptoms of neuropathy and consume alcohol, regularly discuss this honestly with your doctor. Early intervention, including thiamine supplementation and alcohol cessation, can sometimes reverse damage that would otherwise become permanent. If you currently drink heavily, do not stop suddenly, as this can cause dangerous withdrawal. Work with a healthcare provider to reduce consumption safely. There you have it, 8 toxins that are silently attacking your nerves and causing neuropathy. From rare industrial poisons like thallium to everyday exposures like acrylamide in your food and alcohol in your glass. Each of these substances has the potential to cause permanent nerve damage if exposure is not recognized and addressed. The good news is that knowledge gives you power. Now that you understand where these toxins come from, you can take steps to reduce your exposure. Filter your water. Choose organic produce when possible. Cook foods at lower temperatures. Moderate or eliminate alcohol consumption. These simple changes can protect your nerves for years to come. Your peripheral nerves are irreplaceable. Unlike some tissues in your body, they have very limited ability to regenerate once damaged. The tingling and numbness that seem minor today can progress to debilitating pain and disability if the underlying toxic exposure continues. If you are already experiencing symptoms of neuropathy, do not ignore them. Talk to your doctor about potential toxic causes. Request appropriate testing. The earlier you identify and eliminate the source of nerve damage, the better your chances of preserving function and potentially recovering. Which of these toxins surprised you the most? Were you aware that something you consume or encounter daily could be damaging your nerves? Let me know in the comments below. Now we want to hear from you. Have you or someone you know experienced neuropathy symptoms? Which of these toxins do you think might have been the cause, and what changes have you made to protect your nerves? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.